Heart health is always important to talk about, and while we know of the things that we can do to keep our hearts healthier, our lifestyles don't always reflect those things. Dr. Tracie Leonhardt from Peaks of Health Metabolic Medical Center is here to discuss what is important to know about heart health. Dr. Tracie, how are you?
Oh, I'm good. Welcome back.
I love when you are here. I love diving into these topics, and I know you're passionate about educating people, but also saving lives, and that's what you were able to do for one of your patients recently.
It was. I was really surprised because I had one of our patients come in. He's in his early 60s. Healthy guy, no medical history, but he was really concerned because his cousin at 57 had a heart attack out of nowhere with no warning whatsoever.
So younger than him.
Younger than him, and both his parents had died of heart attacks. So I'm like, well, let's take a look. Let's be a little bit proactive here, you know, because he had some little early subtle signs, normal cholesterol levels, but just slightly elevated inflammation, slightly elevated triglyceride levels. So we decided to do what we call a cardiac calcium scoring on him, which is kind of a CAT scan of the chest that looks for calcium deposits in the heart. Because there's two kinds of, plaquing. There's that sudden clot that you can't find, or there's that buildup of calcium. And his actually showed two occlusions. And I mean, one was 100% blocked, and the other one was 85% blocked.
Wow.
So he now has two stents, but he has a perfectly normally functioning heart because he never had the heart attack that causes the damage to the muscle.
So what I'm taking away is you were able to look at the symptoms or lack thereof in this case and realize that more testing needs to be done, and that's what you're able to do at your center.
That's what we do. We're into preventative care. I want to find it before it happens, because once the heart attack happens, there's a lot of work you have to do to try to get recovery because the damage is done. It's doable because actually that 57-year-old came to me too, and we've done some things to kind of get his heart muscle to recover, and he's doing really well. But once that damage is done, it's really hard to recover. So, and cholesterol is not the only thing that is a component here. One of the things we found now is you have this Teflon coating on those vessels in your body. And if that Teflon coating, we get that new pan and nothing sticks to it.
Yeah.
Once we wear that pan down and we damage it and we don't take care of it, things start sticking. Well, that's the same thing with our arteries. And now we know that there's something called a glycocalyx in there that is that Teflon coating. So the cholesterol can't even bother you if that thing's working.
So that's working, but you're still at risk, and that's what you're starting to realize.
That's what we're starting to realize. So we're starting to look at those other signs, those deep, the more intervascular signs. We're starting to look at the actual cell and the cell wall instead of the blood and whether the cholesterol is there, because 50% of the people with heart attacks have normal cholesterol. So we're starting to look a little bit deeper into the system. So we can find these things way early on and start correcting them before the problem happens, and start looking deeper in and find the blockages before the person has those heart attacks.
And of course, we're talking about heart health right now, which is the example that we're using, but this is just one example of the many services that you're able to do, because you look at patients as individuals and find out what they need to help them, right?
Well, exactly. I mean, we do a lot of hormone replacement therapy too, and most people don't know 1 in 7 women will have cardiovascular disease, but once menopause hits, it goes to 1 in 3.
Oh, wow.
But because estrogen is that protective to the heart. Same thing with men and testosterone, very protective to the heart tissue. So when that goes down, that's why all my type 2 diabetics always have low testosterone. So this is one of the things that we can do proactively to correct this, to help prevent that from happening. That's a 50% difference.
And again, prevention, I mean, that just seems like the key word. You want to get people in their peaks of health.
I mean, we do a lot of diet, we do a lot of nutrition counseling, but if you don't turn around and correct some of these underlying imbalances, you can end up with a lot of problems later on.
Say someone's watching at home and they think, well, I'm healthy, I don't, need to worry about this yet. What do you want people out there to know? Because again, getting people to their optimal health is the goal to prevent things from happening.
Well, it's amazing. I have, matter of fact, after this, he sent all his friends in, and they come in, I want that high panel you do. I want you to look for the disease. And they're like, I'm perfectly healthy, there's nothing wrong with me. And we'll go through that and okay, this is wrong, this is wrong, this is wrong. He goes, oh my God, I had no clue all this stuff was going on. But these are things we look a lot deeper into the system. We do a lot more laboratory work, and we look for things early on. So we're looking for subtle signs of changes to come. So we can find a lot of things in there that are happening now, like diabetes. We can find 10 years before the person's diabetic.
Oh, wow.
You can change their lives by changing them at 10 years out and prevent the diabetes from ever occurring if you know how to catch it early.
Good stuff. If you are interested in more information and you want to spend some time with Dr. Tracie Leonhardt, of course, you are welcome to, but you are also welcome to a special offer right now. How about a free 15-minute consultation when you mention the morning blend? This way, Dr. Tracie Leonhardt can get to know you a little bit and your story. But as always, for more information, there's the website and phone number on your screen.